All right. Sorry. Um, yeah, you want to be as specific as possible about actually what you did in the as part of the audit or the research, so that it's not, because otherwise it's easy for people to kind of say, oh, I was involved in a research project that did this. But as we all know, being involved is very different as to whether or not you collected all the data, wrote it up, presented it, did the analysis, blah, 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 versus I helped like collect two patients' data. Now, clearly you need to be honest, but you want to use positive language that would instill a sense that you did a good amount. So you don't want to say I contributed to. Contributed to would, to me, mean I basically didn't do anything. I did a tiny bit. Whereas if you said I instigated, or I was, the main driver of this project, blah, 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 then that sounds like you're taking a lead, even if you weren't technically the lead person. So, just think about how you phrase things. I would stay away from using the expression, I led the study, because it is very rare that someone who's applying for an ACF level would be the overall lead of a piece of research. Usually there'd be someone more senior who would be guiding the research. That may be the case, and if that is the case, then just be very specific and clear about that point. But you can say I led the implementation of, or I led the data collection and the analysis, blah, blah, blah. But saying I led the entire study usually comes across as that you haven't understood what that means. I appreciate there will be some situations where that's not true. In general, if you can, well, no, not if you can. In general, you can make all of your answers shorter. And the difficulty is that when you give your application to someone else to read, it is very easy for them to make it longer. It is so straightforward for someone to say, oh, you should also say this, and you should also add in this. What is very difficult is for someone to come in and say, you don't need this, you don't need this, and cut out all these words. So if you can find someone who will edit ruthlessly and remove stuff, then keep them sweet and buy them a bottle of wine or something, and get them to read your application and cut into it. In general, the shorter it is, the easier it is to read, and the more that a marker will like it. When you're talking about careers, it's very helpful if you can suggest a timeline, meaning I'm applying for my ACF to start in September 2026. I anticipate that I would be in a position to apply for a NIHR fellowship, with submitting my application in September 2028, and therefore, if successful on the first time, aim to start my PhD September 2029. Now, you don't have to necessarily be quite that specific, but having some appreciation of the kind of timelines involved is good, particularly when it gets to interview stage as well. So this is sort of, yeah, what the overall aim is, but the idea about the timeline bit is that most people are not successful first time round when they apply for their funding, and so if you're not successful first time round, then, and the application usually takes about a year by the time you submit until you can actually start, then you just have to be sure in your mind that, well, if I submit my application at the beginning of what would be ST4, and I'm unsuccessful first time round, then the earliest that I could start second time round would be beginning of ST6 or even ST7. So having an awareness of that timeline is helpful. And then just the final point, and I'm aware I'm guilty of this myself, but when you hear people talk about academic careers, it often does sound like, oh, I just did this and this and this, and I followed the pipeline. Or people will say, I took a really unusual path, blah, 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 and I've ended up in this great clinical academic post. Either way, you have huge selection bias from the people who are giving these talks, because they're the people who have, for whatever reason, ended up in that position. So even if you don't get an ACF, don't worry about it. There's lots of routes to both academic medicine and non-academic medicine, and being happy in life. So well, I like to think I'm at least 2/3 along this line, but who knows where I am at the moment. Okay, so that was my kind of first little spiel, and then I've got some kind of specific stuff after that. But I guess I wondered if anyone had any questions at this stage.
I had a question.
You go for it, yeah.
So it's a bit more about what happens after the ACF, because from what I just saw from the timeline was ACF, ACL. So how does a fellowship fit into that sort of framework? Like, what are the pathways you can go after an ACF?
Yeah. So an ACF, the options are, well, the default is you do your ACF, and then if you applied for nothing else, you would fall back into training, full-time clinical training, and then you would carry on and be a whatever you are. So let's say pediatrics. I know pediatrics. Let's say you did pediatrics ST1 ACF. You do your ACF 25% research time up until the end of ST3, and then ST4 you would be full-time clinical standard pediatrics trainee, and if you didn't apply for anything else, you'd end up CCTing in general pediatrics. What is sort of expected is that you would aim to apply for funding to allow you to do a PhD. And a fellowship is the term given to funding that pays your salary. And it's a little bit confusing because people also use the term fellowship to mean like a post CCT clinical experience job type thing. But in the research world, fellowship means funding that pays your salary. And in order to do a PhD, you want someone to pay you. So you have to apply for a fellowship in order to then take time out to do a PhD. You have to have a PhD or an MD in order to apply for an ACL. And an ACL can start essentially any clinical stage of training, but in general would start at ST5, 6, 7-ish, and they last for a variable duration, but 4 years is the standard, and they are 50% clinical, 50% research-ish. Is that what you meant?
Yeah, thank you.
Yeah, no worries. Someone's written about listing stuff in Whitespace. Question about presentations, publications. Do we list our achievements like a citation, or do we weave it into a paragraph? I think that one, what I've seen people do is where it says like list you, because there's basically several sections, isn't there? There's one section that's like list your national presentations, then list your international presentations. I literally just listed them like a citation. And then there's a separate section that is tell us about everything you've done in research, 600 words or something, and then tell us about one project in detail for 200 words. So the top bit, I would just like chuck it in like a like a citation. Yeah, if everyone agrees with that. So Moritz, yeah.
Hi, thanks very much. What do you suggest we do when there are no specific jobs for the thing I want to do? So for example, I want to do ICU, but probably want to do medicine first, and I'll be applying next year. And sometimes there is an ICU ACF, and sometimes there isn't. Sometimes there's often ones in medicine, but I know that there's a lot of, and it's a bit controversial trying to apply to something like RESP, which is related, but not exactly the thing you want to do. And then, yeah, so any advice on
that? So you will have to accept my naivety about, I don't always know exactly when the relevant things tend to start. So are most of the ACFs for ICU ST4 entry?
I think generally there have been, ones that you can do as either IMT1 or ST1. But this year I was surprised that there are very few. So I don't know if that's changing.
Yeah, I mean, I it's not a scheme I've specifically looked at. I've said, and I've not mentored anyone who's necessarily done that path. I would have imagined that they would be more at ST4 level entry, because particularly with intensive care, because the majority of trainees, obviously you can come via both the medicine route, respiratory and anesthetics route, but given that the majority of trainees are often like dual training anesthetics route, then I would have thought that the majority of people would have done ACCS or whatever it's called now, common STEM first, and then entered. In terms of a general point about what to do if there isn't a job, well, I suppose there's two elements to this. The first bit is don't worry and just keep doing the work. Like, I guess I approached it that I knew I wanted to do my PhD in Cambridge at the time. There was a specific group institute I wanted to work in. And so I decided that I wanted to move to Cambridge, whatever. And then, so my plan was to apply for the Cambridge Peds ACF. And if I got it, great. And if I didn't, then I would apply to Cambridge Standard Pediatrics and then go there and then try and my plan basically been to just then work on what would be an application for PhD funding in my spare time whilst doing standard pediatrics training, apply for funding, get funding, go out to a PhD and then go in. Because you can enter the academic training path at any route. And really an ACF is only all it does. Well, it does several things, but one is just the title, which unfairly makes it subsequently easier to get follow-on research funding. But it just gives you time to do research, to generate pilot data, to put together an application, to submit it, which you can do in your spare time. It's just no fun. Well, depends how fun you find it, but like you're not being paid to do it and you're doing it when you're already working a full-time job. So the way I approached it, which other people may not, was that I knew I wanted to do a PhD. I knew where I wanted to do it. So I was going to go there and work on it and get the funding to do it no matter how, even if I didn't get an ACF. I know other people wouldn't like that approach and would prefer to take a year out and then like reapply to an ACF the subsequent year. Obviously that's suitable, but they are highly competitive because everyone is applying has already got a strong CV and has thought carefully about this. And there is a huge amount of randomness involved in all these applications. So you can be really good, but your examiner that day or marker or interviewer has just had a bad morning, and then they give you a crap mark for whatever reason, and then you don't get the job. And then, like, what happens if that happens 2 years running? So I would have said that not getting it it's not the end of the world, and I would just probably crack on with clinical training. But people may feel very differently about this. The final consideration is geography, and I guess I at the time was willing to move anywhere when I applied for my ACF, but quite specifically wanted to move to Cambridge. However, I would have taken a PEDS job pretty much anywhere which had an academic centre. I wouldn't have taken a job somewhere which had, in the field that I was interested in, no research, because there's no point in doing that. So if you decide to, let's say, right, there's no ACF jobs, I'm going to apply to standard respiratory or medicine or whatever it is. Just try not to, and you want to do a PhD, and you want to be a clinical academic. You don't want to end up in a region that has very little research in the field that you're interested in. Because if you're in the right place, even if you don't have dedicated research time, there's always ways to get funding and to get the papers and to do the work.
Very helpful. Thanks.
No worries. So someone said, are you allowed to make several funding applications during your ACF? Yes. There are specifics around this. Like most of them will only allow you to apply twice. And often there's an interval, like they won't allow you to apply the subsequent year, but I wouldn't worry too much about the details right now. And what's the difference between a fellowship funded PhD and locally funded? I mean, to an extent, nothing, in the sense that you still get a PhD, but from the NIHR's perspective, what matters to them is that you have got independent funding, meaning you have a fellowship funded PhD rather than someone else just giving you money to do a PhD. So from a practical perspective, if you can get funded to do a PhD, it doesn't really matter how you get funded, you just get the funding and then do the work. But from an application perspective, you are totally focused on getting data to put together a strong application to get a fellowship to do your PhD. And then what we said, what would you recommend? Okay, we'll talk about that, about the single project, in a minute. Some questions which are not scored. You will come to both of those in a minute, Abe, if that's all right. How does the panel assess academic potential? Is that in relation to which question is it? Sorry. What I have to confess to having not done is personally reviewed the marking scheme in the last few weeks. Hank In, your question about how does that panel assess academic potential, can you give me a bit more background? I'm not sure I understand, I'm sorry. I'm not, okay. Oh, I see, right. Thanks. If I'm being really brutally honest, your number of papers, that would be my single, and your number and the quality of papers. Like, if you showed you had a first author paper in New England Journal of Medicine, like, I mean, you've got pretty good academic potential. If you have one middle author paper in some random Frontiers journal, then that's better than nothing. If you have no papers, then you have to work quite hard. Anyone can talk a good story in an application, but evidence is what matters. And that's why that first opening line in every white space question, I just like throw all the data in there. I've given 1,000 hours of lectures. I've got 200 papers. I don't, but just put numbers in there so that there's no ambiguity. I hope that answers that. Okay, yeah, Devon, great question. So, for anyone who hasn't read, the question is, if you know you're interested in the speciality, but you don't know necessarily exactly what research you want to do, then how do you approach that? And do you need to develop to what extent do you need to have a research plan or idea or field before you apply for an ACF? And I guess I would say that you should have some feeling of roughly what flavor of research you want to do. But it doesn't really need to be any more formal than that. So, for example, I knew I was interested in, at the time, I was interested in metabolism. And I was interested in pediatrics and rare pediatric metabolic stuff, probably related to the liver. And I wasn't sure at that time whether I wanted to do pediatric endocrinology or pediatric hepatology, but from a metabolic liver perspective. I thought I was interested in mitochondrial disorders, and I thought I was interested in insulin resistance. So I thought I'll go to Cambridge because they've got a world-leading mitochondrial unit and a world-leading Institute of Metabolism. And basically in my interview and in my application, I said, these are the things I'm interested in. I really like rare disease. This is what Cambridge does. I don't know exactly who I want to work with. I don't know exactly what I want to do. I think I'm most interested in lab science because of XYZ. And looking back, it's easy to tell that I had, easy to conject that I had an extremely specific idea, but I probably wasn't that specific. And actually now I'm working on something relatively tangential. So I think if you could say, like, I'm interested in this speciality, the academic aspect of it that I'm interested in is this. And I think that I want to do more kind of either lab-based clinical trials, qualitative research, data-driven research, then that's useful. The other thing I realize I'm ignoring because of my bias is medical education. And you may be interested in medical education and that is your bag, and equally can say then I'm interested in doing an ACF because I want to be a true educationalist rather than just doing teaching. So I would suggest having those distinctions. But in short, you don't need a really specific research plan, and go for it. The whole idea is that this is 9 months to figure out what you want to do. You just need to word it carefully in your application so that comes across that you are passionate and want to do it, but it's not that you don't have a clue at all. Is that helpful, Devon?
Yeah, that's brilliant. Thank you very much.
No worries. How do you reckon that's what it does not have a theme? Okay. Yeah, so these themes are so my understanding of their themes is limited, is the main caveat. And my only real experience of dealing with it is that I applied for my ACL, which will be at a different level, but and the theme of that which I applied to was multi-morbidity. And I applied basically saying, I want to study an ultra rare disease, biliary atresia, and do like hardcore immunology and single cell sequencing. And then was like, kids with liver failure and adults with liver failure also get respiratory failure and cardiovascular collapse when they die, and they get renal failure and they get encephalopathies. So that's kind of all the systems. So that's multimorbidity. And the panel had no problem with that. I think that the more important point is that what you say you want to work on aligns with the kind of thrust of the work in that region. And if it kind of pertains to the theme, then that's great. It doesn't have to be like bang on. I've got an example I'll show in a minute that which I think kind of really hits home the point that, yeah, there has to be a reason that you're applying to the ACF you're applying to, and it needs to touch on the theme because it's stated, and it needs to align to roughly what the region department is good at, but it doesn't have to be solely based on that theme. Someone else is going to have to help me with this question. At the point of going from shortlisting to interview, are your marks included or are they wiped? I don't know.
I may be wrong, but from my understanding from the website, it's a total score at the end of it.
Okay, there we go. I mean, either way, do well on the application and do well on the interview. So yeah. Okay, thanks. Cool. So anyone have any other questions right now? Okay, so I have so several of you very kindly shared your applications with me. I'm sorry I haven't had time to read them all, but there's basically I've taken some examples from each of the white space questions, and hopefully that'll give us some useful points for discussion. So this is my like general approach to answering all of these questions, and I'll send you all my slides, by the way, so you don't have to worry about writing anything down. And I'm recording this, and I will put it up on the website and send you a link as well. So so I just thought I'd put this out here before I would get really boring and repeat myself all the time. So like the way I would approach all of these questions is the first line, you like summarize everything you've done and how you will hopefully score maximum marks on that question. So even if they don't read another word in the first sentence, you've scored the full marks. And then you go on to give several relatively specific examples saying exactly what you did, using all the buzzwords that you would expect. And then you'd say what the outcome of that was. Again, often repeating the first thing, like a publication in Nature, or I tutored people for 6 months and they passed their exams. And then a nice way to like wrap up these questions is to say, this illustrates or demonstrates that I am someone who finishes projects, can stick to time, and I'm good at multitasking. These will make me a good clinical academic, pediatrician, intensivist, surgeon, whatever you want to say. This will make me good because you need to deliver on grants, care for patients and juggle multiple responsibilities. And that is like the formula that I used for every application, white space question, and just repeated it and like changed the words. So I hope that seems reasonable. It doesn't obviously work for every single one, like if it's, you know, tell us about one project, but I still would generally follow that. So the first question, at least in the ones that were sent through to me, was this evidence of outstanding achievement outside of medicine. So my suggestions are, it needs to be outside of medicine, because otherwise it's really annoying if you're reading one of these and someone then talking about some teaching they did, because medical teaching. It doesn't really matter what it is, but make it as exceptional as possible. That is probably the single most important thing. And make it as international, national level as possible. Even if that's like, you know, I was on Bake Off, then put that on, rather than, even if there's something else that you think is possibly illustrates your traits better, but if it's something memorable and a big deal, then put this in. And then what's critical is to put at the bottom, this illustrates that I did blah 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 blah, and this person's application, I liked how they put in that it showed that their discipline, teamwork, and ability to balance clinical and academic commitments. Yeah, that's great. You know, clearly those are all things that are relevant. And then what would be nice is to finish that off with saying something like, I will use this in my career as a academic pediatrician when I am caring for patients and writing papers, or something like that. Yeah. So then the next questions tell us about experience of having delivered teaching. Again, this is very specifically asks about delivering teaching. So make sure you include that. This person started out actually with a first sentence that was kind of summarizing, I've experienced teaching experience in this, this, and this, which is great. I think I personally would like even more specificity on that, and saying, if you're able to put it into the first sentence, how much, like, have you done? I've done 100 hours teaching, or I've done, I've been teaching for 2 months, 3 years, whatever. Give some quantity onto it, and again, numbers onto it, so that it sounds real. This person mentioned that they'd done some national level stuff, and I think that's really good, because there's certainly, at least when I did it, a box saying like it's national level work. Make sure you include those kind of various buzzwords that score higher, like I conceptualized and I led. They're definitely helpful. And another good term here that this person has included is recruited. So even if, for example, you didn't deliver all the teaching, but you then helped to work with other people, then saying you recruited other people is great. Then how you kind of wrap this up, there's several ways to do it. This person has said, I want to improve my teaching skills by doing a PG Cert in education, which is totally fine. And you know, I know that the way that the job system is at the moment, then there are other incentives for doing PG Cert, like, you know, getting more points in subspecialty applications. Though if you were to get an ACF, then you would automatically have your subspecialty job. There are some people who would argue, me being one of them, that you're either an educationalist or you're a researcher. Of course, researchers will teach, but that's different to being a career educationalist who is going to define how we teach in the future, what we should teach, how we should be getting feedback, how we should be assessing students. That is not the same as delivering teaching. So I guess if you think that it will help your application to say you're going to do a PG cert in medical education, by all means put it in. If my advice to you in life would be, if you want to do research, don't waste your time doing a PG cert in medical education, particularly if you've got an ACF already, if you want to do research. Yeah, I think the other ways to wrap up this question, if you wanted to, would be you can say that delivering teaching is an integral component of being a clinical academic, and I plan to do this long term. Or you can say it's also given me transferable skills, including presenting, which is part of what I will do with my research, and collaborating with others, both of which are absolutely fundamental to future research. Okay. So then we've got a question about experience of audit. Again, this is one that, like, the mark scheme is really, at least last time I looked at it, pretty straightforward. They just want you to see that you've done multiple audits with complete cycles in the relevant specialty, and if you can say you've done that, you're through. So very helpful to have as the first line. I have completed 3 audits in pediatrics, 2 of which we have performed multiple cycles on, and I led all of these audits. Boom. Then, like, you've just got your points. And then, of course, the first audit was this. The second audit was this, and the third audit was this. Keep the description of the audit as short as possible. Like, what I mean is in, like, what you actually did. If you assessed VTE prophylaxis in children, as I did, some terrible audit long ago, but then, like, we audited VTE prophylaxis in children undergoing surgery. Boom. I conceptualized the audit along with my supervisor. I collected the data, I analyzed it, I presented it. We then subsequently implemented an educational tool, and we re-audited the next year, and we demonstrated a significant rise in adherence or something like that. In 2 sentences, the audit. The second audit was this. So yeah, it should be relatively formulaic, hopefully. So yeah, I like how this person has specifically said that they collected the data and they did the analysis and that they presented. That's very helpful. Now, we aim to re-audit. To me, sounds like no re-audit is happening. Whereas if you were to phrase it in a different way, like the re-audit is underway, then you still won't get the points for it having been completed a cycle, but it just sounds better. Now, obviously, if there is no re-audit happening, you cannot lie, but just make sure you don't sell yourself short. Yeah, and then if you can finish it off with a sentence like this, which one of these applications did, which was brilliant, like the skills I've learned are transferable, which is great. It just would like another sentence on that, like the skills that I've learned, i.e. data collection, data analysis, presentation, and seeing a project through to the end are critical. And again, I like this bit about collaboration with senior colleagues and peers, and that's very helpful because that's a part of what you would do as an academic. So then there's these 2 questions that are, I don't know, to me seem very similar, but I guess I I guess one is meant to be more skills and one's more experience. So you sort of just have to think about everything that you've done that is possibly related to the specialty and like pack it in. So one is skills and attributes, but sort of just see it as like a bit of a CV dump on here. So this person has said, I passed my ARCP and I'm in FY2. Yeah, I guess you can say that, but like that's the absolute minimum standard. So I probably wouldn't bother writing that. I mean, you're not allowed to apply if you've not passed your F1 ARCP. Whereas like here is the point to say, I got honours at medical school and I have sorry, probably there's several ways to approach this. The way I would tend to phrase it actually would be, a good academic pediatrician is academically strong, has good practical skills, and is good at time management. And I have demonstrated this by, whatever. I got honours at medical school. I've done 20 pediatric cannulas, and I don't know, have passed my first stage MRCP, PCH. That kind of stuff is your opening sentence. So it's nice if you can link your skills to the specialty you're interested in to demonstrate that you understand what it is like to be a whatever your specialty is. And if you've kept a logbook of various procedures, then this is the time to throw it in. I liked what this person had done, where they said a little bit about feedback, said I was bomb. However, I would make it much stronger than this. Described me as working above the expected level is like I wouldn't phrase it like that, because that sounds like almost a backhanded compliment. Described me as the best junior doctor they'd ever worked with. Maybe they didn't say that. Again, you can't lie, but if you have feedback that you can put in quotation marks, then that was it. Like, I remember once in one of my ARCPs, my educational supervisor said he would trust me with the smallest and sickest of babies, and then I like put that in quotation marks and stuck it into my next job application, and that sounded quite nice, and I didn't have to make it up. And then, yeah, I would phrase this question slightly more towards the clinical aspect than the academic aspect. Both, but ever so slightly more leaning towards the clinical bit. So, yeah, this person had the space to write. It gives me opportunities to do this and then that, and future academic leadership. Great. But I wouldn't say it's necessarily core for that question in my mind. Then the next one is achievements that demonstrate your commitment and the development of skills alongside. Again, personally, I think they should just have a single question for all of this. But anyway, what I liked about some of these applications is that people had written how they were interested in their subspecialty in medical school, and then in the foundation program, and then in their F3 year, and now they're doing this. And clearly, like, it came across as saying, well, this person's wanted to do this forever. It's obviously acceptable for you to be applying to something that you just decided you wanted to do yesterday. But in this question, you have to convince someone that you have demonstrated commitment all the way through. And there may be some duplication between this one and this one. So for example, at the point of applying for my ACF, maybe I hadn't had at the point of applying for ACF, I hadn't had the results of the PEDS exams, but let's say I had, and had taken an F3 year. It may be relevant to say I've demonstrated my academic abilities for pediatrics by passing my knowledge and practice first stage MRC PCH. And then here you can say I've committed to pediatrics by starting my MRC PCH examinations, for which I've already passed the first 1 and 2. And I personally think it's okay to have an element of duplication between both, as long as you're answering the question. Yeah. Right. So then there's this really quite difficult question saying, give us brief details of all your research projects, which, depending on how much you've done, could be really difficult. So here is where you really need to lean into your opening sentence and your closing segment, and then shove everything in the middle. I've seen some applications where people have done that really well. They've included bullet points, even though it probably doesn't format as bullet points, but like you can still do new lines and hyphens and stuff, and that works. And so, for example, this person here has said my experience spans this. I would have liked to see more detail in this even, and say I have undertaken 3 basic science projects, and this, and an integrated degree. In total, I have spent this long doing dedicated research, and this has resulted in 7 presentations and 3 publications. And that's quite a strong opening statement to say, I've done bucket loads of research. And then they go on to say, for example, I've done this, and this. If you're in the position where you've done loads of research, then you may actually have to summarize like a big chunk of it. Like if you've done a whole load of different little projects that you contributed to at medical school, you may have to say, I was involved in several clinical cohort studies, which led to being co-author on 3 papers. You may have to put that into a block. If you've then separately done, an MB PhD, which some people have. If you've got really standout stuff, like, for example, this person said that they had some research funding, I was supported by, some money, just be really clear that if you applied for it, I applied for funding from this place and I got this much money. But I would not put complex abbreviations in here. Like, I know what CiteOff is, and it's really cool that this person's done CiteOff at their level. But the person reading this is probably not a bench scientist, and they're probably a clinical academic who may do no lab science. And I would avoid acronyms throughout the entire thing, apart from perhaps ACF. So keep it really simple, and only use terms that you are completely sure that everyone will understand. Where you're talking about papers, specify when you're first author. That's really important. Or joint first author if you're not literally first, but it was shared. And I quite liked this summing up statement to say about enthusiastic to continue it through an ACF, and further research expertise in research design. I would have liked a little bit more specificity, saying I'm particularly interested in focusing on this aspect of work in my ACF, because this whole thing has said I've done qualitative, quantitative, bench science clinical cohorts. You want your last sentence to be, out of all of this, I'm particularly interested in this. I'm applying to this ACF to get further experience, to get preliminary data, to blah, 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 that sort of thing. Then you've got your one research project. Now, in terms of selecting this, what at least this application here is absolutely right. Your most novel and high impact. Yes. If you've got a paper, this should be related to the paper, like because it will sound really weird. For example, if you have I don't know, let's say you have one first author paper further up the application, and then you don't talk about that here. That's okay as long as you justify it, because metrics do matter, unfortunately. And if you've been funded, like, or you got a prize, or you presented it, or you got a paper, then that is what you need to put here, and then just talk it up, really. But one thing that this person did put in this question, which I thought was great, is that they kind of broke it down into little sections, saying a little introduction, and then saying, these are my research priorities, this project, and then my proposed directly support. And then they went on to say how it was related to the research that was going on in the department that they're applying to. They talked a specific section about collaboration, which is brilliant, because everything that you do, well, for your entire career is based on collaboration, to be honest, and addressing that directly is good. I liked that there was a section about dissemination rather than just saying, I got a paper. It sounds way more kind of flashy to say, I presented this project at an international conference and I had a publication. And then if you've done any form of patient public involvement engagement event and can mention that, that's great. And then, wrapping up and saying, in an ideal world, what you talked about here will be what you then go on to say you want to be related to your subsequent research. You can put last sentence there. And then, like, the key question, or like the main, is like, why are you applying? Your personal statement type thing. Again, I personally would unashamedly repeat my most impressive achievements in this again. So, why are you applying to this particular one? Well, I'm applying because of, I'm applying here because of this region, and I want to be working in this field, in this thing. And then go on to talk about your interests and why it aligns. So this person has looked up the local research strategy, and obviously some of the ACFs come with a proposed project, and you want it all to hopefully nicely marry up to your experience, your interests, the local kind of expertise, and the project. If it doesn't, you've got to make it sound like you're interested in what they're working on. So, for example, they didn't at the time, but let's say hypothetically, let's say I was applying to Leeds for an ACF in gastroenterology, but I wanted to do liver basic science research. It would be really dumb for me to write in here saying, I really want to come to Leeds, it's a massive transplant unit, and I want to do basic science, liver research, using blah, 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 blah. Because there is no one doing, not very much at least, basic science liver research in Leeds. So it would be a ridiculous thing to say, even though it's rooted in some relevant kind of truth. So what you put here has to just make sense. If you're already working with someone or collaborating with them, you can put it here. Do you have to be to apply? No. And that is totally okay. What I guess, I don't personally think it carries a huge amount of weight to say, I've spoken with Professor XYZ and they're happy for me to work on their project. Like that, I don't really like. I don't think that carries a huge amount of importance. Whereas saying I'm interested in metabolism and the intersection of insulin resistance and genetic variants, and therefore I'm interested in working with one of the principal investigators in the Institute of Metabolic Science. That is enough, because it says you know what you're interested in and what happens here and why you're applying to this specific fellowship. And then if you can tie it into like, and I've previously done a project on this, which may be discussed earlier, but if you've got space, you can put that in. You know, this person sounds like they have a very specific plan, saying exactly what they want to investigate and exactly how they're going to do it. I mean, I don't know the field. I'm assuming this is a reasonable research plan, and if that's true, then that's great. And then they've gone on to specify not just what they're funding, but which funding program, and ultimately a lectureship post after that. So that is, I'd say, a pretty solid answer from my perspective. So those are my thoughts on some questions. Has anyone got any questions or comments about that? Oh yeah, you can probably abbreviate SFP. Sorry. Would you recommend to avoid saying things like, oh, in terms of giving specific results, I would recommend giving some indication of the scale of it if it's impressive. You know, I audited 12 patients. Just don't say how many patients. I audited 12,000 patients. Then yeah, you can include that. But I wouldn't go as far as putting in like p-values and stuff. Just something to give an idea of, was it a big deal or not? Sorry, so someone's saying for the DSA1 project, my first author project. Oh, sorry, Devin, go on, was that follow-up?
Hi, yeah, sorry. I just wanted to ask about the research question when you're listing. It says research skills or experience, and I know you've given a couple of examples here, and I just wanted to clarify whether you think it's better to have sort of headings of the research projects that you've been involved with and a little explanation underneath, or if it's better as sort of like one reflective paragraph going from I did this and this, I built on it in this research project, etc., or as those separate sort of subheadings.
I would group it somehow which makes sense. So if you have done different kinds of research, which is not uncommon, so like some clinical cohorty stuff and then some little bit of data-driven stuff and then some basic science stuff, then you could group it into those three blocks. Even if that doesn't necessarily completely neatly fit into research projects, then that would be quite a helpful way to group it. I probably wouldn't do it as a narrative acquisition of skills, because it could be hard to read. It'd be harder to write, I think, in a way that would be like concise and to the point.
Okay, thank you very much.
No worries. For the DSA1 project. Sorry, someone's asking a relatively specific question about which project to put for the one to discuss. I think it would be forgiven if you hadn't completed the analysis on a network meta-analysis. That is not totally trivial. So then that is fine. I think that if you're first author on a network meta-analysis, I would put that in because that sounds pretty cool. You can say that you were supported in doing the analysis, which I'm sure you were, even if someone did 80% of it and you did 20% of it. If you did the data collection, you wrote it up, you interpreted it, you saw it through to publication, I would definitely include that rather than some, like, we described the rates of formula feeding in infants with biliary atresia in 20 patients, which is dreadfully dull. I hope that helps. Good question, Devon, about quality improvement products in the clinical audit question. I would fill it with audits first and then specify if you've also done quality improvement projects afterwards, because I'm sure, at least last time I looked, that there's marks for completing the cycle. And you want to make sure that they know, you know, there's a difference between audit and quality improvement project. Oh, yeah, good question about referring to what's previously said. So, yeah, Daniel, I would say that you can, if you've got something really impressive, say it as many times as you need to. Like, I've got a first author Nature paper, say it in every question if you need to. If it's like describing a project, then yes, absolutely, you can say the biliary atresia project I described above also led to this. Yeah, then that, and then you can use that to illustrate a trait, and try and keep it as short as possible. In general, if I'm ever going through an application and trying to remove words, it's always in the description of the project and what people did. Well, advice for meeting the academic lead. If you're going to meet the academic lead, I would read their last papers and their most influential papers, and know what they do and what they're interested in, because and like the kind of work they do. That should be your absolute minimum requirement, is to know what work they do. And then it's good to have an awareness of the kind of work that other people in their department do, so that then you don't need to come with a complete research idea. You just need to come with a flavor of what you want to do. Saying, so let's say in the department where I work, if someone was going to go and meet with Shish, Prof. Shetty, who's the head of the unit, he probably would expect someone to know that there is someone working on T cells, there's someone working on fibroblasts, there's someone working on endothelial cells, and there's someone doing more clinical based research. And if you're going to go and meet with the head of the department, you probably need a general direction, because it'd be pretty hard for them to help you. I think this goes for anything, whether this is related to an ACF or not. All you would need is someone to say, like, I think I'm interested in PSC. And you're like, right, I know who I'm going to point you to. You go and work with Palak. He's doing PSC. Or, I think I'm interested in metabolism. I should go work with Trish. There we go. Or like, I definitely don't want to do basic science. Fine. Well, you can go and do clinical work with Matt Armstrong. And so that's the kind of thing. It would be unusual for someone at an ACF level to pitch up and be like, I really want to work on whatever, this specific gene in this specific cell. No one is expecting you to do that. Okay. All right. Any more for any more? Abe, did I cover both your questions? Take that as a yes. All right. Cool. Fine. So I hope people have found that helpful. Feel free to. Oh, are you offering individual? I have in the past foolishly just given out generic offers to go through individual people's applications, and then either worked myself into the ground doing it, or well, regretted it. So at this stage, I'm probably not going to give a broad offer to review anyone's application. If you email me with like a specific question, then I'll look through it, but I won't read the whole thing. So yeah, let's leave that as a balance. If you email me with a specific one saying like, I don't know how to answer this question, I will get back to you, but give me enough time and tell me the date that you need it back and give me a deadline. If you don't give me a deadline, I won't do it. Just because I'll forget and it will go to the bottom of the pile. So, all right, I will. Once this is uploaded and stuff, I'll put it on the web and send you all a link, and you can share it with anyone who wants to. So, best of luck, and thanks for everyone getting involved. Have a nice evening.